Hi, and welcome to Hiss and Tell, a cat behavior and more podcast, hosted by me, Christina Wilson, animal behaviorist. Today's episode is all about end-of-life care, from hospice and palliative care to euthanasia. This is a topic that isn't talked about much, but is a really important part of our pets' journeys with us. So join me as I speak with Dr. Sheila Robertson, Medical Director for Lap of Love Veterinary Hospice. Hi, and welcome to Hiss and Tell. I'm Christina Wilson. I'm with my guest today, Dr. Sheila Robertson. She is the Senior Medical Director for Lap of Love Veterinary Hospice. Welcome, Sheila.
Well, thank you, Christina. And it's really, really nice to be invited on your show, which I've listened to many, many times, but didn't expect to be a guest.
Well, thank you so much. I'm really, really grateful that you're here. I've been doing, as listeners know, and you may know, a real series on pet loss and grief. And I really thought that getting into veterinary hospice would be a valuable part of that topic. So I'm really eager to have this discussion with you and to let our listeners know how they may kind of help ease their pets who are at end of life into a good ending. So to just jump in, can you tell me a little bit about your background, your education, how you got into working with Lap of Love?
Yeah. So I grew up in Scotland in the
Mm-hmm.
United Kingdom and graduated from Glasgow Vet School a long time ago. So I've been a veterinarian for over 40 years. And so my specialty up until recently has been anesthesia and pain management. And I've worked in academia, um, private practice, mixed animal practice. And then I did work in the animal welfare division at the AVMA for a couple of years as
Mm-hmm.
well. And then I joined Lap of Love almost 8 years ago.
I know you were telling me when we were not recording that the founders of Lap of Love were your former students.
Yeah,
Yeah.
yeah. It's what comes around goes around, isn't it?
Yeah.
So Danny McVitie and Mary Gardner, when they were at University of Florida, I was their professor for a lot of the pharmacology lectures, and
Mm-hmm.
then obviously anesthesia, and then obviously they both did clinical rotations with me, and now they're my boss.
I think that's actually quite a nice story. So, because you have this special interest in sedation and anesthesia and analgesia, can you tell me a little bit about how that led you to be interested in veterinary hospice?
Yeah, so one of the things I've always noticed when I was going through my career is that the animals at either end of the age spectrum, the little tiny ones and the
Mm-hmm.
pediatrics and the really old ones, kind of always, we didn't quite know what to do with them. And then the veterinary profession has become so good with pediatric procedures, and I'm also certified in shelter medicine and
Mm-hmm.
learned a lot about how to anesthetize tiny little things. And then I saw this huge gap where we're just not as good or as sure what to do with the much, much older aging population. So obviously, dogs and cats are living a lot longer because of good medicine and so on. And so they become one of the biggest things to understand is they become frail like people,
Yes.
and they have often multiple diseases. So they can be a real challenge to anesthetize. And so I was really trying to investigate and work with people that worked and anesthetized very, very elderly people, what was so fragile about these patients. And then, people think, well, you're an anesthesiologist and your patients are all supposed to wake up. And that is true. But then I realized that I call it the last appointment or the ultimate anesthetic, right? It's the
Mm-hmm.
last anesthetic that they're going to have, and they're not going to wake up for it. And because of all the diseases they may have at the time, which I've seen in clinical practice, over the years, I felt that my skill set was, maybe going to really help develop some better sedation techniques for euthanasia. And we at Lap of Love always, always do sedation or anesthesia prior to the actual euthanasia event.
Of
Um,
course.
That's not a given in every appointment. There are
Really?
Oh yeah. So although the AVMA do suggest that whenever possible we should sedate and or anesthetize prior to euthanasia, we still hear from many clients that basically the appointment was they arrive, the pet, cat or dog, cat, we're talking about cats, is taken away, has a catheter placed, and when they come back, it's a quick IV injection and it's all over very quickly. So I've done some recent surveys, and I would say less than 40% of, well, more than 40, well, probably about 60% of people now really get that sedation is a good idea.
Sure.
But there's, another 35 to 40% where they are not doing pre-sedation.
That's
And it's very,
horrifying.
very, yes, it's very sudden and it's very abrupt. And we get owners telling us that it was like they were there and then just very suddenly, very quickly, they were gone. And we can get into all the reasons why
Yeah.
sedation or anesthesia is so important in that final appointment with their pet.
I think we should, but I'm curious to know because I have unfortunately, working with animals for so many years, and I've personally had so many animals that I've, gone through this. I have never ever had an animal euthanized without the use of sedation. And do these tend to be the kind of old school vets that also don't believe in pain management for animals? Because I have run into some old school vets who are like, we don't give pain management for animals after a spay. Like that, they don't need that, which I find insane.
Yeah, yeah. So I fought that battle, my entire career. And early on, when you think when I started out 40 plus years ago, we didn't have a lot of good pain medication,
Right.
but we were educated enough to know that a mammal is a mammal, like a human or a cat or a dog. And so the whole, the neuroanatomy and pain pathways are the same. So it wasn't that they weren't feeling pain, we just didn't recognize what the signs of pain were in
Right.
those days. And now we have, our toolbox is very, very full of really great things that we can give. Every year something great, a new comes out for either acute pain or chronic pain, and that's been very, very active for cats just recently. A
Yes.
lot of new products for cats, which has just been, it used to be cats were always a second thought by drug companies, and that's no longer
Mm-hmm.
true.
Let's just jump right in and talk
Yep.
about why we should be doing sedation when we're doing euthanasia.
Yeah, so a lot of the pets, as you know, have been struggling with their health issues up until the day that the owner, with probably a lot of advice and thinking and support from, hopefully a lot of good support from their healthcare team, their veterinary team, have decided to say goodbye.
Hmm.
And so by offering sedation, which nearly always includes an analgesic, it might be the first time in a long time that they've actually seen their pet at peace, like restful and calm, and they're able to hold them and pet them, which they may not have been able to do up until that point. And they just see them in that, really, you can call it cloud nine, whatever you want to call it, but in that peaceful state. And then the other reason that we like to do heavy sedation or anesthesia is that we always try and either we try and step away and give the owner a very, very private moment so that they can speak to the pet. Because there's
Hmm.
some people that really they want to say something just as they would say to a person that they love, that they
Sure.
know is close to the end, but they may not want to say it in front of us. And so we give them that moment of privacy, and we encourage them to tell their pet, that they love them and thank them, and we step out. And so if we've got them safely sedated or anesthetized, they have that really important moment of privacy alone with their pet. That's very important.
So I know a lot of our listeners were asking, is there an alternative to giving the sedation as a shot? Or is that just something that we have to deal with right now?
Yeah, well, definitely giving them things like gabapentin ahead of time, which a lot of
Right.
people do in order to have a less stressful cat, veterinary visit. And then
Right.
we now have Bonquat, the new pre-gabalin, which is a
Mm-hmm.
liquid that just came on the market in March. So that's easier to give and make them, a lot less stressed. We can give them a little bit of buprenorphine in their mouth because a lot of these cats are, got painful issues, or
Yes.
often mobility and just they're very achy, and that makes them hyperesthetic. So
Right.
even an injection with a tiny little needle, to them it's real because their pain threshold has been altered by their chronic pain.
Right.
So often we will try and give something orally to take the edge off. And then, there's other things that we can do with the injection. A lot of the protocols that we've developed at Lap of Love that any veterinarian can have access to on our website. Some of them they can be given sub-Q, and they work
Oh,
very
okay.
well because I mean, when you have the little cat that's like skin and bone, and there is no such
Yeah.
thing as IM, right? There's no
Yeah.
muscle. So we have some protocols that work very well sub-Q. So this makes it a much smoother, transition for the owner to watch. And we usually explain. We don't explain everything in detail, but we
Sure.
explain that the general. This is the plan, and this is what's going to happen. This is what you'll see. And if we see something else while we're doing it, we'll explain, why Lily's doing that. Um, you know, as we go along. So I think
Of
that's
course.
a good way to do it. So we do. I would say I just actually looked at the data for our Lap of Love veterinarians, and we're now, gosh, we're doing like almost 12,000 appointments a month now.
Wow.
Um, but most, a majority of our pets are dogs, not necessarily
Mm-hmm.
cats. But when I looked at the cat data specifically, I would say about 50% of our veterinarians go in a vein, and
Mm-hmm.
the other half are using the kidney.
Oh,
Yep,
interesting.
under anesthesia. Yep.
Yeah, of course it makes
Yeah,
sense for
obviously under
the
general
older pet. Yeah.
anesthesia.
Yeah.
And the other thing is, if the cat is nice and sedate or anesthetized, it means we need fewer people, right? It can
Right.
be just the owner and anyone that they want there, and us, right? We don't need someone helping us hold off the vein. We don't need someone else in the room. We don't need all that extra help, which is
Right.
distracting for that important time.
Sure. So generally, just for our listeners, when a veterinarian from Lap of Love comes out, it's just the veterinarian.
It is just a veterinarian.
Yes.
We don't have they don't have a technician or nurse with them. They're on their own. Yes.
Yeah. Okay. So I want to go back to that statistic that you touched on. I know we talked about a little bit before we started the recording that only 10% of the animals that you see are cats. I find that really interesting. I know we talked a little bit about, of course, that it's, dogs tend to be, most dogs are larger than cats and more difficult to get to the vet. But I wish that more cat owners knew about the service and knew about in-home euthanasia. So are there any other reasons that you think that people who have cats are not taking advantage of the service or of in-home euthanasia?
No, because I mean we know as many homes in America have cats in them as there
Right.
do dogs. So I think it is a lot of it is to do with the fact that they feel like, yes, I can get my cat in a carrier, and I can get them to the vet. Although we all
Mm-hmm.
know people and cats often find that very, very stressful.
Right.
But I think, cats really don't like strange places, and to expose them to a very strange place at the very end is, can be quite stressful for them. Although there are, I mean, I work with some fantastic, top-notch feline-only practices that
Mm-hmm.
do, fantastic job with the euthanasia. They have a beautiful room. Of course, during COVID, we were doing euthanasias outside, and a lot of actually one of my friends that I who has an amazing cat clinic, a Brick City Cat Clinic in Ocala, Jenny Salpeter.
Hmm.
She started doing outdoor euthanasias during COVID, and she hasn't really completely gone back to doing them indoors because they have a beautiful area behind their clinic that's got trees. It's got like little gravestones from their local little cat community cats that are all there, and it's very peaceful. They don't have to deal with other people in the waiting room. So she's actually, some people have not gone back to going indoors, and the owners quite like that privacy of a nice area behind the clinic, and it's
Yeah.
out, it's in nature.
Guys, we should talk a little bit about Lap of Love and the services you provide, and exactly what is a veterinary hospice for our listeners who may not know.
So we provide, most of our appointments are in-home euthanasia, but we
Hmm.
also offer tele hospice. So we all, obviously there's a lot of people that they're not sure, is there something that can be done, or is this euthanasia? And often on a phone consult that can be, you can help them, you know what's really going on, what's the next step, and so on. And then obviously we do hospice care as well, but
Hmm.
that would be, you know, most people would understand in people palliative and hospice care. So I think the first thing to point out is that hospice is not a place. So a
Right.
lot of owners think that, well, if I choose hospice, they're going to go somewhere, like often people, but more and
Hmm.
more people are having hospice care in their own home.
Yes.
So it's not a place; it's a philosophy of care. So this is when there's no curative intent for the disease. So there's no longer diagnostics, and we're not trying any more treatments. We've decided either it's a terminal disease, it's not
Hmm.
treatable, or the response to treatment was not optimal, or owners can't afford the treatment, and we never judge them for choosing hospice. And hospice is not about extending suffering, it's about
Right.
helping the cat live as well as it can for the time it has left, and for the owners to witness that. And we actually just had an internal discussion recently. Our average hospice patient, we only have them in hospice for between 2 to 10 days. So it's usually
Really?
really short. Yep, because a lot of it's like they need to come to terms. Maybe family members need to come home because they don't want to say goodbye remotely. They want to come home, kids coming back from college or something.
Mm.
And we don't do diagnostics, but once they enter hospice, we're not offering diagnostics or
Right.
um, saying, what more can we do? We're like, we've accepted that this is now a comfort care package
Hmm.
until you choose euthanasia or the pet dies. So, and then so if it is a hospice appointment, it's usually quite a long appointment with the veterinarian, and then they write up the plan. And then we're very, very lucky to have an amazing team of hospice nurses. So it is a bit like the human system.
Hmm.
So the hospice nurses will get all the instructions and the information from the veterinarian, but they're the ones that will reach out to the owner with all the information that they need, tips and tricks on, if a medication has been suggested, how is the best way to give that? How do you keep your cat hydrated? How do you, not force feed them? All the little tips and tricks and
Right.
information and support is what they get from the nurses, and they're an amazing team.
Can you describe the process that a pet owner goes through when they reach out to Lap of Love for assistance? So let's say that they have a cat who's terminally ill. They reach out to you guys, let's say for hospice, then leading to euthanasia. What is that process like?
Yeah. So if they found us, and a lot of them have
Hmm.
either been sent or given the phone number by their veterinarian, or they find us
Right.
online. So the first thing is and probably one of the most difficult things they're going to do is pick up the phone and make that call.
Yeah.
And so we have a support support center, and we're very, very proud that our live answer rate is well over 95%. They're very well versed in pet loss, grief, and counseling. And probably the first thing they're going to say is, what's your pet's name, and is it a boy or a girl? And so these are key things like, is a dog or a cat? What's her name, and what's going on? And a lot of them just sit there and listen. And we have plenty of people in our support center that have sat and listened and talked with an owner for well over an hour, and the owner doesn't book an appointment, and we don't mind because we've done
Yeah.
that's what they need. And often they'll say, well, I'll think about it, or right there during that phone call they book the appointment. And so we find out, where's your zip code, do we have someone in the area, what are we looking at, is it urgent, could it be in a day or two? And
Hmm.
then we have very, very simple pricing, because I think that's one of the things when people call a veterinarian, and if they're not well set up for this type of appointment, they're saying, well, how big, like, and there's all
Yeah.
add-ons, and do you want this, and do you want that? So we have pretty much packages. So there's not all these like, well, would you like this? Would you like that? It's kind of a given, and there's not an add-on. Like, I mean, it's a given that they're going to get paw prints and a hair
Yes.
clipping. We don't even ask. They're going to get that. It's all rolled into one. And then the other big important question is that they get asked is, and what would you like to do with, let's say it's Lily again. What would
Hmm.
you like to do with Lily after you've said goodbye? And then that gets us into what the choice is for aftercare. Are they going to, and then they might say, well, what do you mean? And they go, well, would you like to, what would you like us to take care of her cremation, or would you like to bury her? And the way it's all scripted out is, everyone has very, very different beliefs and wishes.
Sure.
Some owners arrange that themselves, some owners bury their pet. So different religious beliefs and what happens, and you know and I think one of the most important things is the the final time that a caregiver sees their pet is really, really important, because that's seared in their mind.
It
I mean,
is.
it's seared in
Yes.
their mind, and we call it the peak end rule. So they may have been going through a rough journey with ups and downs, but if the very, very end is good, that really kind of like influences the whole experience that has come prior to that. So if it's a
Hmm.
cat, after we've done the euthanasia and verified that, you know, death has happened, that the pet has passed, we leave again to give the owners another private moment to say what they want to do. And then we come back with a basket and a blanket. And and we never wrap or cover. We just pop them in a really soft, it's a nice little wicker basket with a nice blanket, and we tuck them in. And if they have toys or, sometimes owners have written a little letter that gets tucked in, right? And that
Yeah.
goes with them. And then that basket usually gets strapped into the seat belt on the front seat, and their head is never covered. And so all the way out to the car, people are still looking at their pet, and as they drive off, the last memory is the pet tucked in safely, and then our vets obviously take care of it. But you'd be surprised. You would think that owners never would ever tell you this in this day and age, that they've seen their own pet put in the cadaver bag in front of them.
Oh, I've had to do it myself. And
Yeah,
that is something that was so traumatic to me about,
yeah,
my best friend Kat's death, that like we had this, his whole illness was traumatic, but I made a plan, we had this everything to give him a good ending, right? It was this
yeah.
whole plan. And then obviously we had him euthanized, and that went well, but then the service showed up to pick up his body, and I had to put him in the cadaver bag and zip it,
That's
and
yeah,
it was awful. And I have so much trauma around that. I've had nightmares about it. It has just been,
that is
it's just
something.
like,
Yeah,
Yeah, it's
that
like putting a
that is
family
something.
member into that. It's
That is
terrible.
something that owners should never have to witness.
Yeah.
Yeah, and if you talk to,
Ugh.
if you talk to people who have had the coroner arrive at a house because of a family member, and they put them in the body bag, I mean, is something that is so traumatic. So that is something that owners should never see. But we also, we train, and I do a lot of talks, like, we encourage, people doing euthanasia in their clinic to up the game a little bit. So if the owner is leaving the clinic, and it was done, in a nice little room, either a euthanasia room, or in a clinical room that you turned it into, made it a little bit nicer and put out, dimmed it down, you can still place the cat in a lovely little basket and tuck it in,
Yes.
and place a flower, or something of the cat's, maybe its own blanket, because owners 99% of the time, as they exit, and you should not, someone should be with the cat. When they exit, they always turn and
Yes.
look, and that last memory, if the cat is snuggled up in their basket, that's their last memory. Yeah.
Yeah. I'm really happy to hear that you guys have developed a workaround for that, because I think it is it's well, even just thinking about it again it is really so traumatic,
Yeah.
to have people
Owners
go through that.
owners there's no need for owners to see that part. They just need to have the
Yeah.
last top.
I mean, from a psych perspective, your last memory is your last memory, and that's going to stay in your brain. And
Yep. Yep.
if it's unpleasant, now you've kind of poisoned the well of all of that hard work that you've done to
Yep. Yep.
make this as good as you can.
Yeah, and
Um,
we definitely try and help veterinarians do better, better, in clinic euthanasia, because we know we've interviewed a lot of our clients, and they won't go back to their vet because of
sure,
a bad experience.
of
But
course.
what we want is people coming back to us, and what clinics want is someone that it has such a good experience. I mean, at the worst possible moment with that pet, that they have the courage to go back to that clinic.
Yeah.
And we actually had, it was actually a little girl. She was maybe 10. She returned to a clinic with her kitten, and she told them, she it was a friend of mine who was the veterinarian. She said this little girl came in all excited with her kitten, and they remembered, well, we euthanized their old cat like less than 6 months ago. And the little girl said, well, thanks to you, we had the courage to get a kitten,
Oh,
because it wasn't, they helped them through the process and helped them
yeah.
with grieving. And then that probably turns into another conversation about the support that owners need after the
Yes.
euthanasia. So it's not the minute we drive away, our job is not done,
Of course.
right?
So let's
Or
talk
yeah,
about that. Yeah.
yeah,
So, I've been talking a lot about grief and managing grief in pet loss, which is often so disenfranchised. And I
mm,
think people have only recently really been talking about how painful it is to lose a pet.
yep,
And so I would love to hear how Lap of Love and how you guys help support your clients after they go through this.
yeah. So we do tell them that, we don't know how they're going to react, and usually we leave some leaflets about, pet loss and grief, and what our
Mm-hmm.
services are. And so the services that we offer are, there's a support group that is completely free, and you don't actually have to be a Lap of Love client to join the support group. So it's a group of people, and it's on our website. You can sign up for a slot, and it's basically led by trained grief counselors, pet grief counselors,
Mm-hmm.
and people can talk about their recent loss, and other people in the group can help them or relate to that. Then we have one-on-one, if they want a private conversation with a special specialist, it is $50 for an hour. And then we have a pet loss journey course that they can take, which is like about a 6-week course
Mm-hmm.
that they walk them through. And then we have a Facebook support group that they can join, and they can talk about and post pictures about their pet, and talk and ask other owners, is this normal? 6 weeks later, I'm still think I haven't picked up Lily's dishes, I haven't put away her toys. Is this, and so we have a lot of things in place. And then, obviously, if we really think someone's struggling, we will suggest, because veterinarians are not mental health providers,
Right.
we will suggest and give them, numbers of people we think that they should reach out to. And we just say, you definitely might find some help by reaching out to these professionals that can help
Hmm.
you. Um, and then we always do a check-in with the owners, like in either an email or a phone call, just to let them know we're thinking about them. And often we do a year later, a year on the pet's anniversary of when they said
Hmm.
goodbye, we send out a reminder. And 99.9% of people really like that. Very
Of
few people
course.
actually don't like the fact that they're like, wow, they remembered, right? 'Cause
Yeah.
we have a system, and so it's like they're, we'll just say you're remembering a year ago today, whatever. So there's
Yeah.
a year. So there's a lot to do, but yeah, you're right. It's very disenfranchised. But yet, if you look at the data on caregiver burden,
Mm.
so looking after a sick pet is just as difficult as it is taking care for an elderly parent with Alzheimer's. And so
Mm.
people start understanding that, and then that the loss can be as great, if not more, than when they lose a family member. Just as the number of people that have said, "Well, I've got to go back to work tomorrow because if I say anything, they're going to say, well, it was just a cat," right?
Yeah.
That's just like, and that's because people don't, if you haven't gone through it yourself, you don't understand
Yeah.
how it
It's
feels.
it's so tough. I mean, just personally, I had to take 2 weeks. I had to close my practice for 2 weeks.
Yep.
I knew I was going to be of no use to anyone.
Yep.
So
So that
it's
was
very
smart.
difficult. And I'm lucky that I could do that. But I want to talk a little bit about the tools that you guys have on your website. There's some really great
Hmm.
tools like the quality of life assessment that I think would be very helpful for our listeners who may have terminally ill pets. Can you talk a little bit about what that is and how people would use that?
Yeah, so it is actually interactive. The
Hmm.
lapoflove.com, and then we have the quality of life tools. So the owner can type in, I have a dog or a cat. Her name is, she or he weighs X number of kilos and has been diagnosed. And there's a drop down menu, and they can, choose a disease. And obviously, we're working on always upgrading it, because a lot of cats
Right.
seem to collect comorbidities, right? So they've not just got one
Yes.
thing, right? But the owner could choose, let's say, what's the commonest one? Chronic kidney disease. So
Right.
Lily is 15. She weighs 4 kilos. She's been diagnosed with chronic kidney disease, and then you click a button, and it takes you into another page, and you answer all these questions, and it comes up with a number. And we always err on the very side of caution,
Mm.
that we're saying, Lily's quality of life appears to be declining. We highly recommend you reach out to we say your veterinarian, or reach out to a veterinarian. And I mean,
Hmm.
that could be us, it could be their own veterinarian. And then they can also click on the disease, so chronic kidney disease, and they'll get a lot of information about what is this disease, how common it is in cats, is it treatable, is there, can we, how, so there's a lot of information on what can be done for the disease, but it tells them about the disease that they've
Right.
chosen on the drop down menu. So we have those tools. And if owners can use those without having anything to do with us, if they, because I highly recommend people start tracking quality of life in their pets at
Yes.
an early age, and then download and write down that number, because as things progress, you often don't see, because you're with them every day, you don't see that decline. But then, little red flags should be coming up when the numbers are changing and you're getting different recommendations. And I think doing quality of life assessments over time really, really help people make good decisions about saying
I
goodbye.
I agree. I'm all for people collecting data across the board, just
Yep.
especially as
And,
a
and I
behaviorist.
would encourage people to keep and date stamp photographs because, you
Yes.
don't, if you're not the chronic kidney disease cat that,
Yeah.
you don't realize that he's now, or he or she's all skin and bone because you're not necessarily weighing them at home. But if you took a picture and you look at the picture from 6 months ago, it's like, wow,
Mm-hmm.
or someone who hasn't seen the cat walks into the house and goes, "Oh wow, what's going on?" And then you're like, "Oh, what do you think's going on?" Because when it's just gradual in front of your own eyes, and then let we've got to admit we've all been there ourselves, and I'm guilty of it. We've all been on denial island or put on the denial goggles, right?
Yes.
As Mary Gardner calls them, because we don't want to face what's going
Yeah,
on,
of
right?
course.
And so
Yeah,
we
but
need
that's
numbers, and if we do a hospice visit, we always do the quality of life assessment with the owner to help them,
hmm
how to do it the first time. And sometimes we'll say, really, why did you choose that number? Because I would have chosen this number. And then obviously, as you're well aware, when there's a lot of family members, they're not all on the same page.
right.
And so we try and focus on the primary caregiver because they're the one who gets exhausted first and
hmm
just they're taking all they're seeing what's going on every day. Whereas someone who's gone to work comes home and says, yeah, like, what was your day like? And they're like, no, I was just, trying to get some food into Lily. I've been mopping up her vomit. I've been doing this. So we try and focus on or at least figure out who the primary caregiver is because they need a lot of support. And they may
Absolutely.
not be getting it from the rest of the family. The rest of the family, like, no, when I come home, she really perks up. What's so not everyone on family members on the same page. So we try and have as many people there as possible, and we go through it together and agree on what the number is or
Mhm.
where we're at in the pathway. Yeah. And a lot of the questions, and I need to emphasize, I can't emphasize this enough, they're not all focused on the disease or health.
Right.
It's
Yes.
it's emotional health is
hmm
what's so important. And actually by really supporting the cat's emotional health when they're physically sick can actually do a lot to counterbalance. So the safe place, to go and retreat, the comfort, nice warm place, the
Right.
predictable interactions, the being, we prescribe, we might be prescribing medication, but we're also going to prescribe, you need to groom Lily 2 or 3 times a day because she can't do herself, but that's human animal bonding time and she loves it and releases lots of, nice hormones that make her feel good. So we're RXing drugs, but we're RXing, bonding time, grooming time, loving on your cat time. So I think everyone has to understand that quality of life is not about all about health. It's about mental health, emotional health, and sickness causes anxiety, and anxiety makes things like pain worse. So it's a balance between the two, and they're equally important.
Yeah. Agreed.
Yeah.
So I also wanted to ask you about the feline grimace scale. If you want to talk a little bit about what the feline grimace scale is and how that could be useful to people.
So the actually looking at facial expressions of pain, actually that's when I went back to my homeland, Glasgow, for my sabbatical many years ago. We were working on an acute pain tool that was composite, so it
Mm,
included lots of things, and that's when well, my group at Glasgow, we figured out that the ears and the muzzle
hmm
change when they're in pain. But I have to emphasize that the feline grimace scale is only validated for acute pain.
Right.
Not to say it's not useful in our what we're talking about. So we published a couple of papers on using the ear position and then
hmm
how tense the jaw was, which obviously alters the whiskers. And
Right.
then Paulo Stigal's group came along and thought, well, wonder if we can do it all through facial expression. So then they spent years, I mean, since 2019, developing and validating the feline grimace scale. And we do know that owners can use that tool, and they're going to be able to use it as well as a seasoned veterinarian, because it's all about pictures. And the other
Mm-hmm.
great thing for people, language is not an issue with that tool because it's all about
Right.
face. Because a lot of language, if it's in Spanish or English, it doesn't
Mm-hmm.
quite translate. So basically, there is an app that you can put on your smartphone, and it literally, you open it up and you look at your cat, and number one, it says choose the position of the ears, and then you go to the next thing, and it's the eye, the eyes open, or are they like, like this when they're painful, and
Right.
then is there, so there's five things that you mark, and then you get a final score, and if they score over a certain number, it's highly advisable that you seek veterinary attention because it's pain. But a lot of cats with chronic conditions have
Mm-hmm.
what we call acute on chronic pain. So the ones with inflammatory bowel disease might be going along just fine, and then they have an acute episode. And
Right.
so this is a nice tool for owners to have, to use, just to double check, like what's going on. Are we having a flare? Is there an acute, are they having an acute pancreatitis, flare? So it's a really good tool. Plus, it's on a phone app, and it's so the feline grimace scale people and another group in Calgary called Sylvester AI are developing actual true artificial intelligence where you'll be able to actually just hold the phone up and it'll scan the cat and look for all
Oh.
those, it's going to look for all those markers, and
Mm-hmm.
then the algorithm, is, we know everybody's got to get the
And
AI. You got to train
yeah.
the AI
Yes.
correctly, right? So the algorithm has to be done correctly. But they're hopefully Sylvester AI, who are based in Calgary, and the Feline Grimace Scale Group, who are Paulo Stigal's now based in Hong Kong. There may be an AI app available,
Mm.
but it is still for at the moment for acute pain.
Right.
Yes.
That's really interesting about the app. I wanted to talk to you a little bit about euthanasia versus natural death. I think a lot of people have an idea that a quote unquote natural death is a good death, or I don't want to say an easy death, but I think people have a lot of opinions about a natural death that may or may not be accurate. So I would love to hear your thoughts on this loaded topic.
Yeah. So we do hear a lot of people say, well, I just want them to have a natural death, and
Mm-hmm.
what we're here what we all know and we all wish ourselves, that your cat just goes to sleep one night and it doesn't wake up, right?
Yeah.
But so when someone says that they would like a natural death for their pet, we usually just pause and we usually just say, so what I hear you're saying is you want an unassisted death, right? So that's just changing their mindset a little bit.
Mm-hmm.
And then we say, if we feel like it's really time for euthanasia, we say, well, euthanasia, which we can explain to you, is an opportunity for you to say goodbye to Lily in her home surroundings, surrounded by the people that love her, right? So it's all can be planned. Now, there are some people, because of their spiritual beliefs or their religious beliefs, like Buddhists, they
Mm-hmm.
cannot euthanize, and so there may be some religious reasons, but we still tell them that it is an unassisted death, and usually what we say is that Mother Nature is not always kind at the
Yeah.
end, and most people have probably had a family member die in hospice, and even with a lot of assistance, it's not always easy to watch. So
Right.
what we say is, what we can help you with is to help. We can do a hospice assisted death, or we can call it, or we now have the terminology, a palliated death. So we're going to ensure comfort until they pass on their
Right.
own without euthanasia drugs. So and that might look like a lot of heavy sedation,
Mm-hmm.
you know, sub-Q fluids, but we're going to be, not, we're trying to help them on their way, but keep them comfortable. So the two new terms now that people are trying to give to owners when they ask about natural death, we first of all say what you're asking for is an unassisted death, and that's not always pleasant. So we can do a palliated or hospice assisted death, and then we can explain to you what that might look like, for this situation or that
Right.
situation. Yeah.
Okay. I think often what people don't understand is that it's very rare for an animal to pass naturally in their sleep. That
Yes. Very,
really
very.
almost never happens.
Yeah. It's only
Um,
happened to me once.
yeah, it's
Yeah, and it
it's
was the night before I was going to euthanize my cat, right?
yeah,
He was in heart failure, but not drowning.
right.
Um, and my husband and I had a big discussion on the Saturday evening. We said, tomorrow's the day. And my husband got up early to spend some time with him and
Hmm.
found him dead. And so we assume he threw a clot, big
Yeah,
clot, because he had
yeah,
everything. He had all, yeah. Because he was just, he was curled up, but that
yeah,
almost never, that almost never happens. And so we do.
yeah.
I mean, sometimes we are pretty, we're as truthful as we can. Like, so if it is
Sure.
heart failure, we do say, well, you probably know about people in heart failure. They find it very, very hard to breathe, and they struggle, and they talk about, like, it feels like they're drowning.
Hmm.
And some people might say, well, that's not painful, because it's not all about pain. We say, but
Right.
that's very, very scary. It's
Yes.
very, very scary. And, our other, and I'm sure everybody pulls this one out, we always say, better a day too early than a moment
Hmm.
too late. And then we have a lot of families that choose euthanasia earlier as they become more experienced pet owners, because they know they
Yes.
left it too long with other pets and they don't want to do that again.
Right.
And the other thing is, we often say, if the pet may die alone if you don't choose euthanasia. They may be alone,
Hmm.
and struggle when you're not there and you didn't get the chance to say goodbye. So there's a lot of things that you need to explain to them. Or we don't do 24/7 emergency care.
Right.
So we always tell them, you need to know where your nearest emergency room is, what the hours are, because if you leave it too late, you may be going there at 2 in the morning, and meeting someone you've never met before, and the journey and everything. And we just tell them this is how it might be.
Right.
Yeah.
And I think to that end, encouraging people to make a plan,
Yes.
which is something I think you guys also do, is so important.
Yeah. Yeah.
So I
Yeah.
think it's very hard often for people to think about that and to really confront the idea that, like, yes, my pet is going to no longer be with me soon,
Yep.
but making a plan for what do I think is a good passing, and what does that look like, and what am I going to do in an emergency,
Yep.
and just having that all written down so that as things get closer, there's no panicking.
Yep.
I think
We
is
can sometimes leave what we call a comfort kit. We don't
yeah,
we don't leave controlled drugs in homes,
sure,
but we can leave something for, to sedate if they realize they're in trouble.
yeah,
And we can leave things that are sedating, or if they just aren't ready for euthanasia, but it's close. We can apply, like, we can give long-acting buprenorphine and some
hmm,
acepromazine, to help them, just be calmer before we leave that appointment. And we can leave, like, acepromazine can go transmucosally and help in cats, and we have a lot more options in dogs to, help them stay calm. We've got the pre-gabalin liquid, we've got gabapentin capsules if they can get them in. But we like to, we sit them and say, you need to have a plan
yeah.
if, you know, if it doesn't go the way you thought it was going to go.
Yeah. And I think, unfortunately, life likes to make things go the way that you didn't think it was going to go. I've seen that many times. So
Yeah,
having a plan is difficult, but I think ultimately worthwhile.
yeah,
So I just want to get to a couple of these questions from
yep.
listeners. One of them was, how do vets deal with the constant sadness of the job? So especially because you're working in,
Huh?
a lap of love, how do you, is that something that you confront? How do you handle that?
Yeah. So so all of our veterinarians have a huge support group. They have each other. They have
Mm-hmm.
a lot of support, and it's amazing to me, because a lot of the published literature would say that one of the things that causes compassion fatigue and burnout and maybe even suicide in veterinarians is this because we're euthanizing
Mm-hmm.
pets. Well, I would say that the lap of love veterinarians are a very content, fulfilled group
Mm-hmm.
because they know why they're going to the home. The
Sure.
people really are very grateful that they're there to help. All the discussion about price and everything's all been discussed before you get to the home. We know the appointments are 45 minutes to an hour. So we find a lot of our veterinarians are very fulfilled and get a lot of professional gratitude out of
Yeah.
doing euthanasias, right? Because people are grateful. So they're not in a busy practice seeing patients every 10 minutes and then people saying, I don't want this test, I want that test. And
Yes.
there's none of that
Yeah.
stress going on. And then they pack up and then they drive to another appointment. So they're working on their own and then they drive between appointments so they have a time to decompress.
Mm-hmm.
They have a lot of support from their colleagues. So I would say that a lot of them are very fulfilled. And a lot of owners say to them every time they leave, I don't know how you do this every day. And they go, it's an honor to be able to do this. And I think that's how they genuinely feel.
I think that
So
makes a
it's
lot of sense.
yeah, I mean, I think it would be nice to do a study between people in general practice and people that do all in-home euthanasia and look at
Mm.
job satisfaction because I don't believe that it's just the euthanasia and that is causing a lot of the issues with people with burnout and so on. It's more
Yeah.
in context, I think. I do talk to ER doctors who are doing these horrendous shifts and they're euthanizing 8 pets. But a lot of that
Yeah.
is the owner didn't have the money to treat, even though, and it was,
Mm-hmm.
they could have fixed it, but they didn't have the money. So it's a young animal, had parvo, and the vet's thinking, why didn't you and it's just like,
Yes.
whereas this end of life care is even though we do sometimes euthanize younger pets because they have bad diseases, it's quite different. And it's not that I would say it's a good job for someone who's maybe a little introverted and just likes to be work autonomously, right?
Mm-hmm.
You work from home, you've got your day organized, you get in your car, you do your visits, you do your paperwork, you drive to the next appointment, and you've got grateful people. The lap of love vets all tell me they've never received so many gifts until they
I'm
joined
sure.
because people are so
I
thankful to them for coming and
yeah.
helping.
I would
Yeah,
think a huge piece of it is that the people are self-selecting in, right? Like the
yeah,
clients are self-selecting in that
yeah,
are really people who love their pets, right? Which is
yeah.
sometimes something you don't see in practice is you see,
Yep.
like you said, you see people who didn't vaccinate or you see people who, you just see a spectrum of people who can be upsetting in a myriad of ways. And then also you're not feeling devalued, which I think is something that does happen a lot in general practice, also with like nitpicking about money or nitpicking about whatever. And I think that leads to so much burnout is just feeling devalued when you're in a caregiving role. So another question was, how can I entice my hospice kitty to eat?
Oh, wow. Oh,
That's a tough one.
yeah.
I know.
Yeah. It's like you need a whole other guest
A
speaker
whole
for
other
that one.
podcast on that,
Yeah.
right?
Yeah. So, I mean, I'm going to go with the most important thing is that you must not force feed a cat that doesn't want to eat. That is the fastest way to break the human animal bond or the cat owner bond. Because the cat will, if the cat is feeling nauseous and doesn't want to eat and you are trying to force feed it, they will run away from you. That breaks the bond very, very quickly. The other thing is if a cat really is feeling nauseous and doesn't want to eat and you try and give it, like, you think, oh, it's got to love like the best deli turkey that that I went and bought for you, they're going to associate that
Yep.
food with being sick, right? The association is very quick. You all know that if you've ever had food poisoning, you cannot step inside that same restaurant without,
Yes.
yeah. So that happens very, very, food aversion happens very, very quickly. So they need help from their veterinarian because we
Yeah.
need to find out, is it because they have chronic kidney disease and they have nausea? And if it's nausea, then we have good medication to give for nausea. Is it that they're vomiting everything up? Then we have good medication, right? We have Serenia, we have
Yeah.
ondansetron. We've got drugs that can help with that. Is it that they're the picky old chronic kidney disease cat? Then we have two medications, right, to stimulate or support appetite. We have transdermal mirtazapine,
Mm-hmm.
which owners love because it's not a pill, it's not an
Yep.
injection. You rub it on the ear with with a glove on, and then we have capromorelin, which is an appetite stimulant that goes orally. So there's lots of things we can do, but the key is not to force feed them and not to think that because you went to the deli and bought the most expensive, delicious turkey, because they will, they're just,
Yeah.
and if you do put down food and hope that they voluntarily eat, if they haven't eaten it within 15 to 20 minutes, pick it up, right? If you are feeling nauseous, are you going to stand in front of the buffet? No.
Yeah. No. No.
Right? You're not. It's going to make you feel worse. You're not, because people put out the buffet, right, hoping they'll choose something. If it's not
Right.
gone and they're showing it, just take it away. But one of the things, and actually is being published, one of the things that in old cats, if you heat their wet food, and
Mm-hmm.
usually wet food, if you heat it to body temperature, they will consume more calories because a lot of times they can't smell very
Right.
well, and so that's another thing to check. Well, as they age, their sense of smell goes down, but they might also have something, crusty nose or something.
Right.
But heating food is good, and then there is a place for feeding tubes.
Yes, I was gonna say that
There
the
is.
e-tubes.
And
Yeah.
so an e-tube, I always say sooner rather than later when they're
Mm-hmm.
still robust and well, not robust enough to, because they have to go under anesthesia for that, even though it's a quick, good procedure. And the other thing is, once it's in, they can still choose to eat. You don't have
Mm-hmm.
to use it. They can be there for if they need more calories, more fluid, whatever. But the other thing is, once the e-tube's in, oral medications are not even an issue anymore, right? Because they
Yeah.
go in the e-tube,
Yep.
right? So that is sometimes why people opt for the e-tube. If we think this is truly a euthanasia and this cat only has, has no chance of recovery or only has a few days to live, that's a different discussion.
Right.
But I've looked after cats with e-tubes, well, and my own for months,
Yeah.
right?
Same.
And they can choose to eat or not. If they don't eat, then they need extra hydration. It's a great tool in the right cat in with the right disease. Yeah.
It is. And I think a lot of people think that it's this big procedure and that it would be so terrible to have a tube. And the cats really don't seem to mind them.
Well,
In
not
fact,
with the new, yeah, not with the
yeah, with
new look.
exactly with the little, the,
the little cool collar and
yeah, they
low
get cool
profile
collars and
low
patterns.
profile tube.
Yeah, it's,
It just
oh,
requires educating the owner, like what can go through the
yes.
tube, how to prepare the tube,
Yeah,
so but that's all. I mean, that's all another story once you've made the
it is.
decision to go in. So e-tubes aren't a terrible thing. I think there can be a very, very positive thing
Yeah, I agree. My one cat who was up here in the middle of our discussion,
So,
she has GI lymphoma and she's had it for many years. And every once in a while, she'll have a flare up that's so bad that she can't eat because her throat gets so irritated. And so we've had to do an E-tube a few times, and she seems to love it. Like, she'll get so excited when it's time to like put the food in. She'll just kind of be like, "Yeah, put it in the tube." Like,
yeah,
she doesn't mind at all. Like, she
yeah,
gets jazzed.
yeah.
So
I mean, if you do everything around that moment with positive
oh
reinforcement,
yeah,
um,
exactly.
then you're off on a win-win right there.
Yes.
Um,
And then the last question was, when my cat was nearing his end, his vet was still suggesting treatments. Why would they do that? And I guess this cat did not have cancer. So this person's just wondering, why are vets continuing to push treatments on a terminal cat?
yeah, I personally don't understand that, but when I was in academia, I would see it a lot with the very young veterinarians,
Mm-hmm.
because as in people, the default is always to treat more, try something
Yep.
else. That's the default. And luckily, we've got amazing people like Atal Gawande, who's now
Yes.
wrote the book Being Mortal and
Mm-hmm.
Medicine and What Matters in the End, saying that the default to more and more treatment is what's caused so much suffering in people,
Yes.
especially in the United States, right? Because you're going to end up dying with lots of tubes in a hospital, and that's not. You should be able to choose how the end is. So I think a lot of that is that um, during vet school there needs to be a lot more comprehensive courses on end of life care and difficult, or what I call tender conversations, around death, and that we cannot cure and fix everything, and and often some owners, maybe it is something we could cure, but they can't afford the treatment, and we
Right.
must never make them feel guilty about choosing not to treat, because they have budgets, right? They
Of
have a
course.
financial budget, they have an emotional budget, they have a time budget to do this. So our goal is to support them through the end. But why? So there are some very, very nice publications on futility of care in veterinary
Mm-hmm.
medicine and what the definition of futile care is, and it's just what you've said. And you know, most veterinarians admit that they have actually provided care that they feel is futile, and that's because the owner wanted everything to be done. But I
Mm-hmm.
think that's where we need to really shore up the veterinary education in teaching people how to have these very, very difficult conversations around death and dying, just as Atal Gawande has a training system called um, the difficult medical conversation, and you can go and train, like, how do you tell a patient they have a terminal illness. And what we the data shows that if you're trained in having those conversations, your stress level goes down, your satisfaction with dealing with the patient goes up, you feel a lot more confident, but the patient benefits. They want,
100%.
for us, that it would be the owner, but if it's a human,
Yes.
they want to know, how long do I have? What should I do in the time I have
Yeah.
left? So I think we need to work on getting, robust end of life courses into every veterinary curriculum. And a lot of that's going to be about communication,
That
and
makes a lot of
accepting that a
sense.
person was like, I've said I don't want any more treatment, and the veterinarian needs to then now switch to supporting that decision and helping the owner and the cat or the dog until the end, either euthanasia or the end happens.
Yeah. I think you're right. I think it's about education, and I think for human doctors and veterinarians, it's very difficult to be in a caring, curative profession and then, you know, admitting defeat, even though it's not
Yep,
admitting defeat.
yep,
But
Yeah.
Admitting a natural process is going to
Yep.
happen.
Yeah, I used to say to my residents, and not just because I taught anesthesia, but to all the residents, because obviously I'm working with medicine and surgery, I said, that euthanasia is a treatment option,
Hmm.
right? That can be laid on the table when you're talking to an owner,
Yeah.
because it's always a treatment option in a very difficult situation or a complex disease. And I always used to tell them, I said, euthanasia should not be looked at as a failure, but we can fail at performing good euthanasia. But it shouldn't be looked,
Yes.
it's a treatment option. It shouldn't be looked at as a failure. And we should be so grateful that as veterinarians, we have that tool in our toolbox, the euthanasia, that we can perform euthanasia, unlike our
You
medical colleagues.
Yes, you are so right, and I think that is the perfect note to end on.
Okay.
So I want to really thank you, Dr. Robertson, for taking
Thank
this
you.
time out of your busy schedule to talk with me about this really important issue. I think we covered a lot,
Yep.
and I'm really, really grateful for your time. So thank you
Well,
so
thank
very
you.
much.
Thank you.
Thanks for listening. If you enjoyed today's episode or any of the episodes, please like and give us a rating. Also, feel free to share with your friends. We'd super appreciate it if you shared on social media or really anywhere. For cat behavior consultations, go to catitude-adjustment.com. You can follow us on social media at Hiss and Tell Podcast. Music provided by Cat Beats.